Hello there, and please make sure that you hit a subscribe button on your way out. Infected Americans were flown home against the CDC's advice. In the wee hours of a rainy Monday, more than a dozen buses sat on the tarmac of Tokyo's Haneda Airport. Inside were 328 weary Americans wearing surgical masks and gloves, waited anxiously to fly home after weeks in quarantine aboard the Diamond Princess, the luxury liner where the novel coronavirus had exploded into a ship-wide epidemic. But as the buses idled, U.S. officials wrestled with troubling news. New test results showed that 14 of the passengers were infected with the virus. The U.S. State Department had promised that no one with the infection would be allowed to board the planes. A decision had to be made: let them all fly or leave them behind in Japanese hospitals. A man and a woman in their 80s died of the coronavirus on February 20th after being infected on the quarantine cruise ship holding nearly 4,000 people. In Washington, where it was still Sunday afternoon, a fierce debate broke out. The State Department had a Trump administration health official who wanted to forge ahead. The infected passengers had no symptoms and could be segregated on the plane in a plastic-lined enclosure, but officials at the Center for Disease Control and Prevention disagreed, contending they could still spread the virus. The CDC believed that 14 of them should not be flown back with uninfected passengers. It was like a nightmare, said the senior U.S. official involved in the decision, speaking on the condition of an anonymity to the described private conversations. Quite frankly, he said, the alternative could have been pulling grandma out in a pouring rain, and that would have been bad too. The State Department won the argument, but unhappy CDC officials demanded to be let out of the news release that explained that infected people were being flown back to the United States, a move that would nearly double the number of known coronavirus cases in this country of course, the United States. This is the quarantine cruise ship. They were flying them back. This is obviously the airplane, and this is a specialized quarantine airplane. So the guy that's taking the picture of the selfie is Spencer Fehrenbacher, 29 years of age, takes a selfie aboard the State Department chartered airplane about to depart from Japan. The tarmac decision was a pivotal moment for the U.S. officials improvising their response to a crisis with a few precedents and extraordinary high-risk. Efforts to prevent the new pathogen from spreading have revealed the limits of the world's readiness for an unprecedented public health emergency. In the worst-case scenario, COVID-19, a flu-like respiratory infection, could become a full-blown global pandemic. Navigating the crisis has required delicate medical and political judgments. The decision to evacuate the Americans from the Diamond Princess came only after infections on the cruise ship spiked. The passengers revealed their grim living conditions. One lesson from that debacle is that cruise ships are like petri dishes. Thousands live in close quarters on a vessel never designed for medical quarantine facilities. The crew continued to deliver food, and health workers moved throughout the ship. More than 600 of the 3,700 passengers and crew members have now been tested positive for the coronavirus. Again, 600 of them were tested positive out of the 3,700 passengers. 2 older Japanese passengers have died. So there's 600 people there that's been tested positive. I tried to zoom in on this portion to show you that it says 600 were tested positive out of the 3,700. That's an alarming number. With Japanese authorities quarantining the passengers for weeks off the coast of the ship quickly developed the second largest number of the coronavirus cases on the planet outside of China, more than in Japan, Singapore, Thailand, and the United States, or all of the Europe. Avoiding another China has been the goal of the World Health Organizations for weeks, and then it happened anyway in Yokohama Harbor. The treatment of the Diamond Princess passengers stands in stark contrast to what happened to those on another cruise ship, the Westerdam, who were greeted by the Cambodian Prime Minister with handshakes and flowers and who later traveled widely. Only later did news come out that one of the Westerdam passengers had tested positive for the virus. That situation spurred fears that the Westerdam passengers would spread the virus around the world, but no additional passengers have tested positive, and so far, no evidence has emerged. They have widely seeded the virus. The coronavirus officially SARS-CoV-2 is extremely contagious. Experts estimate that without protective measures, every infected person will spread it to an average of slightly more than 2 additional people. The disease COVID-19 has been fatal in roughly 2 out of every 100 confirmed cases. So 2 out of 100 people are dying from the cases. That, if you're infected, you got a 2 out of 100 chance that you're going to probably die. Travelers have already spread it to more than 24 countries, where it has infected more than 75,000 people and killed more than 2,000 people. Waiting for the knock of doom. This is a little story about that guy who was taking a picture of himself. The Diamond Princess left Yokohama for a 15-day cruise on January 20th. One man from Hong Kong left the ship when it docked there 5 days later and checked into the hospital on February 1st. Officials confirmed he was infected with the coronavirus. Spencer Frebenbacher, 29, the guy that you saw before taking a picture of himself on the airplane, an American studying for his master's degree in China, signed up for the cruise with friends as a break between semesters. Just a couple of days in, they became alarmed about reports of the coronavirus spreading in China. In Vietnam, he came down with a fever. It lasted only about 24 hours, but he feared he might have the virus. He decided not to get off at the next 2 stops in Taipei and Okinawa because he was afraid he would end up quarantined. Great. Thanks for spreading the news, right? The ship sped back to Yokohama and docked on February 3rd. Japanese authorities told passengers they could not leave. The next day, they mingled aboard. Many ate a buffet dinner, but the casino was closed and evening show canceled. That night, the captain ordered passengers to return to their cabins and stay there until quarantine officers came to see them. Over the next several days, test results trickled in. Dozens had become infected. Fehrenbacher kept fearing the worst. I was sitting there all day, waiting for what I called the knock of doom on the door, he said. Fehrenbacher stayed in his room every day, all day. He had a balcony, and that was good enough. He started using the word optimistic when he spoke to friends and family because positive carried a bad connotation. He recorded a video and sent it to his brother to share with his family in case he was hospitalized and unable to communicate or even died. He said, "Mom, Dad, I love you. I miss you. I'm sure everything will be okay." He recalled saying. 5 days after the ship reached port, the CDC wrote a letter to the American passengers saying that remaining in your room is the safest option to minimize your risk of infection, and adding, "We acknowledge that this situation is difficult." Really? For nearly 2 weeks, the only way off the Diamond Princess was through illness or a ride by ambulance to further isolations in hospital. A complaint to Congressman Tip Balances. For some of the difficult situations that became dire by the score, people tested positive. The crew members, meanwhile, were forced to stay at their jobs. Some 200 passengers were over the age of 80, at much higher risk of dying from the virus. Obviously, the situation on the ground changed. Clearly, there's been more transmission than expected on the ship, said Michael Ryan, WHO executive director for health emergencies. It's very easy in retrospect to the judgments on the public health decision made at a certain point. On February 12th, U.S. officials briefed members of Congress in a closed-door hearing. Representative Phil Rowe, our team, a doctor, had also heard from a friend and fellow doctor, Arnold Hopeland of Elizabethton, Tennessee, who was on the ship with a wife and Hopeland reading derivatives. That tipped the balance, said the senior administration official. By Friday afternoon in Washington, there was agreement among all agencies in the U.S. Coronavirus Task Force and the executive evacuate the Americans. The State Department, through the U.S. Embassy in Tokyo, posted an urgent notice to the U.S. citizens. Americans who wanted to leave needed to let the embassy know by 10 a.m. Saturday local time in Tokyo. In all, 328 Americans disembarked from... Sorry, I don't know why I went past that so fast. So they went through covered windows, and basically the walls and everything were covered. Some began crying because they needed to use the bathroom, said Vanna Mezabal, 69, of Crystal River, Florida. The retired nurse had been taking the cruise with her husband Mario, 75, who was also a physician. We just couldn't understand why we were sitting there loaded and not going anywhere, she said, and we couldn't get any answers. Eventually, the buses arrived at the airport, and once again, everyone waited while top officials in Washington argued about the test results, according to a senior administration official. Nobody anticipated getting these results, said another U.S. official involved in the evacuation. During one call, the CDC's principal deputy director, Anne Shushat, argued that taking the infected Americans on the plane, according to two participants, she noted the U.S. government had already told passengers they would not be evacuated with anyone who was infected or showed symptoms. She was also concerned about infection control. Anthony Fauci, head of the National Institute for Allergy and Infectious Diseases, who was also on the calls, recalled saying her points were valid and should be considered. But Robert Cadillac, Assistant Secretary for Preparedness and Response for the Department of Health and Human Services, and a member of the Coronavirus Task Force, pushed back. Officials had already prepared the plane to handle. Half of all corona cases outside of China are on the Diamond Princess cruise passengers, health officials say. Let's find out. Please, again, make sure that you subscribe to this YouTube channel. Thank you. I do my best to bring you up-to-date news pretty much whenever it comes. So here we go. You're going to see the airplane leaving early in the morning. Here we go. A charter flight transporting passengers from quarantine China. Quarantine Diamond Princess cruise ship moves behind the military airplanes after it arrived at Travis Air Force Base in Fairfield, California. That's right, Fairfield, California is where the airplane landed with 380 plus passengers that are infected with the coronavirus. Great. So Sunday, February 16, 2020, a dozen American passengers evacuated from the ill-fated Diamond Princess cruise ship who are believed to be infected with the coronavirus are being treated or watched for signs of illness at Northern California hospitals. So there's several hospitals that they're sitting at right now, according to federal health authorities. Of these, 4 developed symptoms of the respiratory illness while quarantined at Travis Air Force Base, despite an earlier clear bill of health from Japanese and U.S. authorities. The new tally released by the U.S. Centers for Disease Control on Wednesday brings the number of suspected cases in the latest group of repatriated Americans evacuated from the cruise ship to 15. The
Hello,
passengers
good
had
evening.
been quarantined
Good
on
morning.
the
This
ship
video right here, I've
docked
already
at
posted this.
Yokohama,
This is a
Japan.
woman that
I
was
want you
actually
to share
released
this
from a
video
hospital,
to
diagnosed
anybody you
with
know.
coronavirus. She was
Happened in
told to be
China.
staying at home
This is a
and was
lady
to be
who went to the
quarantined at her
hospital
home.
and
On her way up
diagnosed
to,
her
I guess,
of
her
the
apartment or to
coronavirus.
the
Now
hospital,
she
or
is
going
going back
back up
home.
to
She
her
got
room.
into a
She's
lifter,
spitting on
a
the
public
buttons
lifter.
to the
She
elevator.
started
You can
spitting the
see her there
virus
spitting,
on the lifter
and
button.
so she's
So
trying
please
to
watch it
basically
carefully.
say,
You
if
have
I
to
have
be
to get
careful the way you use
infected,
public
so does
things.
everyone
Keep
else.
watching. Here we go.
Nowadays, because the world is
Not
wicked,
everyone
people are
that
so
you
wicked.
think that
Just watch
has
what
this
the lady is
virus
doing.
is just
Watch
going to
the
be
video
like,
carefully.
oh, this is only a virus that only I have to deal with. No, there's actually
Now
very
people coming
demonic
into the
and
lifter,
evil people out there that have this virus.
and once they come into the
Just
lifter,
like
automatically
people
you
that have
must
AIDS and HIV, they
touch the
want to
button
infect as many people as they can
to the
to
floor you're going
basically
to.
bring everybody
So
down, bring
you
as
see
many people
how they
with
distribute
them,
the virus.
you
That
know,
is why the virus
as many people as they can down with them.
is spreading so fast,
These are very evil people,
because
and of course,
demonic
everybody
agents
now on
are
that
at work.
elevator has been
Okay, now
infected
she stays
because
into the lifter
now
because
she's
she
coughing in
wants
the
to
air, spitting on the
really
buttons,
pollute the
and
place with the virus. See, she keeps spitting on the
you
door,
can see
spitting.
that
She
she's
keeps
covering her
spitting
mouth,
around.
and as she coughs and sneezes.
Watch carefully.
Here's
Now
comes
this is
another
another old
gentleman
man
here.
who came up
He's also
with the virus. See
infected.
how
He
he will
actually
spit on
looks
the
at the
lifter
buttons
button.
in the elevator,
Then he will
spits
spit
on
on
the
his
elevator
hand. See,
buttons, and
he
then
spit on
spits
his
in his
hand.
hand,
He
and then
rubbed it on
wipes
the
all
buttons
the
of the
buttons.
lifter.
And
Just
then
watch.
again
You
spits
see?
in his hand again and wipes the buttons,
Yeah.
and then
This is how they
closes the
distribute the
elevator door,
virus.
and then just
Hello,
lets
good
people walk
evening,
away.
or good morning.
There is a
I
lot
want
of
you to share
demonic
this
people out
video
there, so just
to
be
anybody you
be
know.
super
This
freaking
happened in
careful
China.
out in public.
This is a lady
Don't
who
touch
went
the
to the
buttons.
hospital
Don't
and
touch handles.
they've diagnosed her
Bathroom
of the
doorknobs,
coronavirus. Now
doorknobs
she
to like
is going back
restaurants and
home.
stuff
She
like
got
that.
into
Like,
a lifter,
just be super
a public
freaking
lifter.
careful,
She
because
started
this stuff is
spitting
out
the
there,
virus on
and
the lifter button.
it's scary as
So
hell.
please
So
watch it carefully. You
yeah,
have to be
I hope
careful
this
the way
video
you
was
use
informative
public
to you. If it
things.
was, please drop a comment down
Nowadays,
below.
because the world is wicked,
Definitely
people are so
drop a
wicked. Just
subscribe,
watch what the lady is
because
doing.
I cannot
Watch the
make
video
these
carefully.
videos without subscribers. I need you guys. You guys need to subscribe. So please
Now people coming into the
subscribe,
lifter,
comment down below, share.
and
Get
once
the
they
word
come into
out.
the lifter,
A lot more
automatically
information coming.
you must touch the
Just keep
button
in mind that this virus actually
to the floor you're
happened
going to.
in China's
So you see
level
how they
4.
distribute the virus.
Okay,
That
this
is why the
actually
virus
to be a level 4. It's like they're dealing with
spreading
some
so
very, very
fast,
serious stuff. They
because
didn't have this facility like
demonic
out in the
agents are at
boondocks
work.
where it's like nobody's there.
Okay, now she stays into
They
the
actually
lifter
had
because
it
she
in
wants
city
to
in city
really
areas. It
pollute
was
the
like
place with the
2 or 3
virus. She
blocks
keeps
down
spitting on the door,
street.
spitting. She
Was
keeps
a
spitting
from
around.
the epicenter, from the food market where
Watch
people
carefully.
were selling
Now this is another old man
livestock and
who
food.
came up
People have
with the
been buying
virus. See how he
livestock
will
and
spit
food,
on the lifter
not
button.
just there, but all over the world.
Then he will spit
that
on his hand.
particular
See,
way
he spit on his hand.
for
He
hundreds of
rubbed
years,
it on the buttons
and this
on
has
the,
never
of the lifter.
happened. The
Just
reason
watch.
why this
You see?
happened was because the Chinese government had a
This is how they
level
distribute the
4
virus.
biological
Hello, good
weapons
evening,
warfare
or good morning.
war laboratory 2 to 3 blocks
I want
down
you to share
the
this
street
video
from this food
to
market.
anybody you know.
And
This
so
happened in
the
China.
government tried to
This is a lady
keep
who
everybody
went to the
quiet
hospital
and
and
hush hush
they
the
diagnosed
doctors,
her of the
and basically just let
coronavirus.
the
Now
doctor that
she
initially
is going
found
back
it,
home. She got into a lifter,
let him die,
a public
because
lifter. She
he
started
had a lot of
spitting the
information,
virus
and
on
they
the
just
lifter
basically
button.
just let him
So
die.
please watch it carefully.
They
You have to
didn't
be
even
careful
really
the
try
way
to
you
take
use
care of
public
him.
things.
So
Nowadays, because
now
the world is
their
wicked,
number
people
one
are so
dies,
wicked.
and
Just watch
2
what
and
the lady
3,
is doing.
you know,
Watch the
people
video
that were
carefully.
in the know basically are all dead now. So yeah.
Now
That's
people
pretty much
coming
it.
into the lifter.
The virus was initially found,
And once they come
and
into the
actually
lifter,
being
automatically
tested in a
must touch the
stage
button
4 biological
to the floor you're
weapon
going to.
laboratory in China.
You see how they
The
distribute the
Chinese
virus.
government
That is why
wanted
the
to actually
virus
see what it would do
is spreading so fast.
either
Because
they call him
demonic
patient
agents
0,
are at work.
and that was a person that was
Okay, now she
basically
stays into the lifter
someone,
because she wants to really
this
pollute
is
the place
this is
with the
what goes
virus.
on
See,
in
she
China.
keeps spitting
They
on the
actually
door, spitting. She keeps
infected
spitting
somebody
around.
with this virus, and that person went and
Watch
infected
carefully. Now
someone
this is another
else.
old man who
This
came
is
up
not
with
particularly
the virus. See how
an
he will
infectious
spit
disease
on the
that
lifter
came
button.
from the actual food itself.
Then he will
from
spit
an
on his
animal.
hand. See,
This is
he
actually
spit on his
passed
hand.
from
He rubbed it on the
human to
buttons on
human,
the lifter.
as you can see
Just
now.
watch. You see?
The main virus
This is how they
spreader
distribute the
is not going to be
virus.
like, oh, okay, the
Hello, good
virus comes from
evening,
birds or
or
the
good
virus comes
morning.
from animals. No, it's coming from people that are
I want you to
obviously
share this
spitting on
video
buttons like
to
this,
anybody you
coughing in
know.
the air,
This happened
and
in
stuff like
China.
that. So it
This
came
is a
from a
lady
person
who
that
went
was
to the hospital
initially
and
infected
they've
by
diagnosed
this
her of the
laboratory,
coronavirus. Now
and they
she
call him
is going back
patient
home. She
zero.
got into a lifter, a public
Unknown
lifter.
person, unknown
She
name.
started spitting the
But
virus on the
the
lifter
doctor
button.
who
So
originally
please watch
knew
it
about
carefully.
this
You have to be careful
2
the way
weeks
you use
prior
public things.
to the virus actually
Nowadays,
spreading and
because the world is
outbreaking,
wicked,
and
people are so wicked.
and the
Just
government
watch what the
actually
lady
knew
is
about
doing.
it.
Watch the video
And
carefully.
they try to keep the people quiet. So again, there's a lot of information that I need to cover.
Now people coming into the
This
lifter.
is not a fluke. This is
And
not
once
a
they
coincidence.
come into the lifter,
This was
automatically you
created
must
by a biological
touch
weapons
the button
laboratory in China,
to
and
the
this
floor
is
you
a
go into.
biological warfare
So
right
you see
now that
how
China
they distribute the
has.
virus. That is why the virus is
They act like they don't
is
know.
spreading so fast.
Of course,
because
but
demonic agents are at work.
that's the fact. That's
Okay,
that's
now
the
she
fact
stays
that
into the
remains.
lifter
There's so
because
much
she
information,
wants
so many
to
videos out there
really
that's going
pollute
to
the place
exactly
with the
confirm
virus. See, she
what I
keeps
have just
spitting on the
said.
door,
So
spitting. She
go
keeps
ahead,
spitting
subscribe
around.
and share. Thank you so much.
Watch carefully. Now this is another old man who came up with the virus. See how he will spit on the lifter button. Then he will spit on his hands. See, he spit on his hand. He rubbed it on the buttons of the lifter. Just watch. You see? Yeah. This is how they distribute the virus.